Hello, thank you all for joining us and this special topic that we have. Again, my name is attorney Vanessa Ruiz with Immigration for Couples. We love getting to know different parts of the immigration system. I know you guys have a lot of burning questions as well. And so our special topic for today is interviewing a civil surgeon, everything that you wanted to know about the I-693 medical exam. And so we have a special guest here, Dr. Jaxel Lopez, who is an authorized civil surgeon for the I-693 medical exam. He has taken time to be with us to answer your burning questions and just tell us a little bit about himself. So, Dr. Lopez, thank you for being here.
Thank you for inviting me.
Yeah, Dr. Lopez, so tell us a little bit about yourself. Where are you from? Where are you practicing?
Yes, so I was born and raised in Puerto Rico and came to the United States roughly about 11, 12 years ago, being in Texas for the past 7 years. And I have a family practice in Irving, Texas. So that pretty much is me in a nutshell.
Yeah, I'm sure. I'm sure you're very busy with all that stuff. But did you always want to be a doctor? Did you know you wanted to be a doctor?
I love how I'm supposed to say yes.
It's okay if
Every
it's a no.
No, it's if you look back into my actual like yearbooks, all the way in like fifth grade, they were saying I was going to be a doctor. But to be honest, it was kind of like just growing into it because you go through that rebellious phase when you don't want to be anything like your father, which I had my fair share, and that ended up being just like him.
That's funny. So was your father a doctor as well?
He's still a doctor. He's not that yet. He's a surgeon in Puerto Rico.
Okay.
He's been
All right. All right.
practicing 45 years now.
Wow. Okay. So then it definitely runs in the family.
Yep.
Well, good. All right. So we're just going to kind of start getting into it. We have a lot of questions that our clients usually ask us, or sometimes that come up in initial consultations.
Mhm.
I know a lot of people try to research on the internet, but there's nothing like having, an expert, a specialist in the topic to go ahead and kind of tell us how it really is behind the scenes. And so one of our first questions is, why do only certain doctors perform the medical exam? Is there anything special that you had to do to become authorized by USCIS to be able to do this?
As with a lot of things that have to do with government, the only special thing is that we actually filled out the paperwork. It's a whole bunch of papers that you need to fill out. You have to be a practicing physician for at least 4 years out of residency. And once you do that, it's pretty much a very rigorous background check. And that's pretty much it. It's just a background check, paperwork, and having practiced for 4 years.
Okay, all right, interesting. So then, is there a reason why you think more people don't do it?
Doctors are not fond of anything that says the word paper and work next to it. So I would guess that that's the reason why a lot just don't do it.
Yeah, too much effort on their part.
It's a lot of papers.
Yeah. All right. Yeah. Well, that's kind of the world that we live in with immigration as well. That's all we do. It's stacks and stacks of paper, so we get it.
Oh, yes.
Yeah. All right. Next question. What is your role as the civil surgeon? A lot of people always ask, do you work for immigration? They want to know, what your connection to them is. Is there any connection?
So the most important question there is no, I definitely don't work for ISIS. No, no, no. But my role is pretty much to screen patients, so making sure that they don't have any contagious diseases that could cause pretty much a disaster in the United States.
Yeah, and that kind of goes into the next question is why do you think a medical exam is required? I mean, you pretty much already answered that. So,
Mhm. It's just
it seems like it's
avoiding those.
important.
It's just avoiding communicable diseases. There's some that have been eradicated that are still running around, and we really don't want them here.
Yeah, that makes sense. All right, so kind of the basics of it, trying to get started. What is it that patients really need to take to the exam?
So the most important things by a lot is please, please, please bring a valid current ID. It has to be current. It cannot be expired, even if it's one single day. That's pretty much the biggest one out of all. And the other one, it would be other than, your government ID, and it doesn't have to be a US ID. It's just your passport, your any governmental ID actually does it. And the other thing would be to bring your vaccine records if you have them. If not, then regretfully, that means more vaccines.
Okay. All right. Yeah, you kind of already answered a couple of them that we have as well. Do they need to present an ID? Can it be from any country? You said yes. So basically, the key to all that is it has to be valid, right? It has to be current, not expired.
Mm-hmm. It's like if you're going to vote, it needs to be valid. You cannot vote with a registration that is from 2004.
Right. Yeah. So then you've had to turn people away before if they didn't have their ID, correct?
Regretfully, yes.
Okay. And what kind of forms of ID can they present that you would accept? Would it be just a license, just a picture ID, a birth certificate, passport, things like that?
So pretty much they call it the El DUI. It's one of the ones that they use a lot. It's pretty much any legal document with their photo in it. Of course, for adults. For children, that's a different story. For children, if they don't have a passport, their birth certificate and a school ID to corroborate that the name matches the certificate should suffice.
Okay, good. So pretty much key as long as they have a picture on there as well, hopefully. All right. So do patients have to bring in their own copies of the actual 693, or are you going to provide something there for them?
Well, at least in my office, we have it digitalized. So pretty much once we put everything in the system, it already auto-populates a lot of the process. That way we don't make mistakes. So at least in my practice, no. They don't have to bring it, we already have them. But I know that some places you do need to bring your paperwork pre-filled out.
Okay. Okay. So always safe to check wherever the person's going to go get their exam done.
Mm-hmm.
Good. And so just to kind of be prepared, how long does each exam take? How much time should they set aside before going?
Well, if everything is moving, it's actually flowing very smoothly. It's in and out in roughly 20 to 30 minutes. But if the practice is busy that day, those 20, 30 minutes can turn into an hour or two. It all depends on how busy it is. But the actual process is very quick because it's just filling out your paperwork, drawing some blood, giving a urine sample, verifying your actual vaccines and checking that everything is up to date. And pretty much that's it.
Okay. Yeah, so it doesn't sound too scary. I know a lot of people are kind of intimidated by the process, but I mean, you've been very friendly. I don't think that I would be intimidated to walk into a room with you, but I know it's just something that makes people uncomfortable when they have to think about it.
Anything that has to do with immigration, I don't think the word is afraid, it's more intimidated because it's a very intimidating process. You're getting into this big thing and you're scared that if it's not done perfectly well first time, they're going to kick you out of the country, which we all know is not the case. You always can reapply. But you do need to pay everything again if you reapply.
Yeah, and it can be hefty. It can be a hefty price, so
Oh,
better to get
yes.
it done right the first time for sure. All right, perfect. So then most of the clinics, probably like yours, also do other things too, correct? So it's not just, these medical examinations. You're doing school physicals and just general checkups and everything like that, right?
Yes, that's correct. I still practice full-fledged primary care.
Yeah. So then also for those of us who know who have been in that waiting room, definitely better be prepared for more time than less.
Yes, please don't go having an appointment in 20 minutes. That
Doesn't
never
happen
ends
that
well.
way. Right.
Yeah.
They're not going to leave happy from there.
Oh, no, most definitely not.
Yeah. All right. So kind of getting into some of the specifics, talking about vaccinations. What are the general vaccines that you're looking for and that most people should have by the time of the actual exam?
Okay, so pretty much the vaccines are required are the ones that the CDC says that year. So this year they added hepatitis B again to the list of vaccines. And if we're in the influenza season, which is from September to April, you also have to get the influenza vaccination of that year. Other than that, you need at least one dose of the MMR, one dose of the varicella, 1 dose of the Tdap, and at least 1 dose of the COVID. Even though COVID is a little bit more strict, it's preferred for you to have both doses of the vaccine, but that usually covers it. If someone has had varicella in the past, then in the blood work, we add the varicella titers to verify that you actually have immunity to the varicella, also known as the chickenpox.
Okay, interesting. Yeah, so it can change whenever. So people shouldn't be, I guess, alarmed if something is required that maybe their friend didn't have to take or their cousin didn't have to do.
That happens a lot. It all depends on how good your mom was keeping up your paperwork. If your mom is one of those that has everything hidden and everything is filed, that little vaccination card that every country has, we just verify all the dates, we match the name, the dates, and usually almost everyone needs to get at least the tetanus booster because that's every 10 years. But anyone that went to the school here in Texas or any state for that matter, they already have all the vaccines that they need.
Yeah. Okay. Yeah. So then if they happen to not have had one of them or if they're missing something, can you go ahead and administer it that same day?
So the reason I actually don't administer them in the clinic, other than the flu, is just sheer economical. Vaccines are very expensive for a physician to acquire to administer. So it is actually cheaper to give them the prescription to get them in the pharmacy, and they can do it at any pharmacy. The prices are pretty much the same in every pharmacy. So that way, at least with me, they're saving easily $200.
Right. Okay. Yeah, we've definitely had some clients ask that as well. If they can go elsewhere and get them and then come back. So then how would that work? If they
So
do go and get them, like, do they have to set up a second appointment or?
no, so what we just require is proof of receiving the vaccine. So we will let them know which one they need because you actually don't need a prescription to go and get the vaccine. You can go to any pharmacy. The Tdap is usually in the 40-ish price. The MMR is usually in the 100-ish price. Varicella is a little bit more expensive. It's like $150. But all we need is the proof from the pharmacy. So you can either bring it to the clinic, you don't need to see me, or you can also send that via text message or email. We pretty much accept any form of communication that allows a file to be transferred.
Okay, good. Awesome. So then you kind of touched on this as well, but if they've lost their records, if there's no card available, I mean, are these people starting from scratch? If you have to get everything essentially?
The quickest and the cheapest way is to just get 1 dose in of the vaccines because we can always check immunity. But then if your immunity is not high enough, then you still have to get the shot. So it's better to just go and get the vaccine. Anyone that was born before 83 had only 1 dose of the MMR, the measles, mumps, and rubella. So almost everyone needs to get a second shot if they get tested for titers. So my recommendation is just to go and get the shot. It's not going to harm you.
Okay, well, good to know. So then you did mention that the COVID-19 vaccine right now is required. And
Yes,
what if a person objects to any of those vaccines? Not just COVID-19, although that seems to be the most popular one right now, but to any vaccine. What do you do as the doctor in your documentation?
that's it. I'm not signing any paperwork with someone that doesn't want to follow the rules. So that, at least for the other civil surgeons that I know of, no one is accepting any excuse other than real medical documentation of allergic reactions or serious complications. Other than that, at least myself, I'm not accepting any. I don't know about other civil surgeons.
Okay. And so essentially they'd have to bring you all the records showing past, experiences and reasons why they wouldn't be able to.
Yeah, of course. Like I've had a couple of cases that it was a clear cut. One of them, she had all the paperwork from the hospital that she had been intubated after a severe allergic reaction to a shot. So of course, like I'm not gonna like no. And the other one, it was I don't know what's the proper way to call them, shaman or something like along those lines, that it was from a reservation in Mexico, pretty much the equivalent in Mexico. And they were getting their paperwork. And of course, it's someone that doesn't believe in Western medicine at all. It is clearly religious. They practice it. You can track, you pretty much you can keep a track on them. They've never been in a medical office in their life. So in cases like that, of course, that's a different story. But what has happened now that somewhere in X religious book says that you cannot get that specific vaccine, at least myself, I'm not accepting it.
Okay, yeah, good to know. So some people may have a hard time finding a doctor willing to sign off on them, things like that. So it's also, for people to weigh their priorities for sure.
Exactly.
Yeah. All right. And so then talking about tuberculosis, how do you assess that? And I know on the actual application itself, it has a big scary name, the interferon gamma release assay. Like, what is that?
That is just a blood workup. It's pretty accurate, and it's just 4 little tiny tubes of blood that have drawn. Total 8 milliliters. That's next to nothing. And if that happens to be positive, then we have to do a chest X-ray, because a lot of individuals that had the PPD vaccine are positive in the blood test because they actually were injected with a live vaccine. So we just make sure that they don't have pulmonary disease, X-ray is done. And let's say worst case scenario, you actually have tuberculosis. That doesn't mean that you cannot get the paperwork signed. You just need to get on the treatment. And once you start the treatment, we document what treatment you're on, where are you being treated, because normally I just refer that to the State Department of Health, let them take care of all those infectious diseases. And once you get that started, you're signed up. Nowhere it says that you're going to be sent back. It's just that we want to make sure that you're healthy and you don't make anyone sick around you.
Yeah, no, definitely. And so I know some of our clients sometimes when they've come to us after having the exam, and I think it's probably, so essentially first step is blood. If it's detected there, second would be the chest X-ray.
Yes.
And then a lot of them come to us and say, well, the doctor saw a dark spot in my lungs. Is that kind of accurate? Is that what you're looking for?
No. So chest X-ray with tuberculosis is very classical. So the tuberculosis likes to be in the top of the lung in a little corner. So you have what is called a cavitating lesion. And the radiologist does that for me. They will let us know in their reading if they actually see active infection or if they don't see anything.
Okay. Yeah, we've heard that a lot where they're like, well, they found a spot. And we're like, okay, what is that spot that they're finding?
Normally, it can just be the shade. So inside the actual lungs, there are several things that can make little shadows. So it can be one of those. It can just be the scar tissue of a pneumonia from the past. There's a lot of things that can be. A person that suffers from asthma, their lungs look a little bit funky. But tuberculosis, it's very characteristic deletion.
Okay. Yeah, okay. Well, good to know. So then kind of just talking about it, a lot of people find out that they have had it in the past or, they currently have it. So is that something that just a lot of people get without really knowing that they've had it?
Well, in this corner of the planet, not that much. In the US, it was eradicated. In most of Latin America, it was almost eradicated. There's still pockets. But then we have places like Africa where tuberculosis kills 1.5 million individuals every year. Here we were going crazy about COVID killing in the hundreds of thousands. Africa has over 1 million every year dying of a disease that we eradicated decades ago here. So what we really don't want is for all those diseases like tuberculosis to start spreading in the States, because I don't recall exactly which date they stopped administering the PPD, but I'm not vaccinated for tuberculosis. I was born in '83.
Yeah. Okay. Yeah. So it's definitely something that we're just not used to, and that's the whole point of the exam, I think. It's making
Oh,
sure
yes.
that those of us in the U.S. who are not vaccinated for things like that don't get exposed to it eventually.
Pretty much it's like a customs examination of a product that is coming in. You want to make sure that there's no bugs and there's no weird animals in that box.
And if there are, we need to get rid of them then.
Exactly, before the product is allowed in.
Okay, good. That's good to think of. So then the syphilis and gonorrhea part. How do you test for syphilis? How do you test for gonorrhea?
So for syphilis is a blood test and for gonorrhea is an urine test. So
Okay.
a lot of people have false positive for syphilis. A lot of people had syphilis and they didn't even know it. Gonorrhea is a little bit more difficult to have it without knowing it, but both are very treatable with antibiotics. Gonorrhea normally is just one dose of antibiotics and they're cured. Syphilis, it depends on what stage it is. It is either very easy or a nightmare to cure. There's three stages. The primary is genital lesions, secondary is a rash all over the body, and the tertiary, it's when it goes into your brain. That one can be a little bit complicated, but mostly all of them are very treatable with one single dose of antibiotics.
No, that's good. Good to know. And so then if somebody has had it before, is that something that's going to show up on your test, or is that just kind of relying on them telling you their medical history?
So syphilis, if you had it in the past, you will always test positive. And then we go by what is called the titers. A titer is how many times you have to dilute the sample and it's still positive. 1 in 2, 1 in 4, 1 in 8, 1 in 16. The bigger the number in the right, the more infection you have. If when you dilute it 2 times, there's nothing there, then probably just immunity from a past infection. If you dilute it 32 times and you can still test for it, you definitely have an active infection. And for gonorrhea, no. The test is a PCR test, very similar to COVID. So if it's positive, it's positive. If it's negative, it's negative.
Okay. So then if somebody does show signs of being positive at the time of the exam, you mentioned, curing that with antibiotics.
Mhm.
Again, is that something that you're going to do, or are you going to send them to their primary care physician?
So if it's gonorrhea, we can do it, but they will have to go through a normal visit. If they have commercial insurance that I'm part in the network, I will more than gladly see them through their insurance. If not, we can do it as a normal visit. But yeah, I can definitely treat that. When it's syphilis, the reason I don't treat it is because penicillin, which used to be dirt cheap, which is the actual treatment for syphilis, now is extremely expensive unless you go through the health department. The health department is, I think it's like $30 around that price, the whole thing, the whole treatment,
Wow.
and the testings and everything. But if you go private, one dose of antibiotic, it's about 400 something, $500.
Ooh, that's a big difference.
Yeah. So for syphilis, I send to the health department. Tuberculosis, health department because it has to be monitored very closely. Gonorrhea, that's something that we see almost every day in the practice.
Okay. So that one's the easiest one of all of them to
One
treat.
shot, you're done. Rosefin 250, boom, done.
Good. All right. So I know in the past you had to, when doing the medical exam, also test for HIV. And we're correct in saying that that one is no longer required and should not be tested for in this exam, correct?
Exactly. The only things that we're testing as of right now, we don't know what's going to happen the next month, but at least as of right now, it will be syphilis, gonorrhea, tuberculosis, and for titers.
Okay. All right. And so then one of the other ones that was mentioned on the application is Hansen's disease, aka leprosy. And so, can you guys just give us a brief description? What is Hansen's disease? I'm sure there's a lot of misconceptions on what leprosy actually is.
So leprosy, it's a condition that you get this parasite in your skin and it starts creating scabs and scabs and scabs. It's very similar to scabies, but all over the body. And then those scabs get infected, chunks of skin start pretty much dying and rotting, and it's a very painful condition. And treating it in the early stages is very easy. It's just medicine that you put on your skin, but if it gets advanced, it's a scarring and very difficult to treat condition. But in the United States, I've seen that, what, about twice. And it was actually in the county hospitals, not in the private setting.
Okay. And so on the medical examination, what test are you using for that as well?
My eyes.
That one's a pretty obvious one. That one's
Oh, yes.
you can look and know.
Yeah, it's the biblical condition that the lepers actually had to hide with their hoods and pretty much look like, the Hunchback of Notre Dame in the cartoons.
Yeah.
There's a reason for, and it's that any skin that is exposed probably has deletions.
Okay, so that one should be pretty easy to
Oh,
catch.
Yeah. It's super
All
easy.
right. Good. So then just kind of wait for your thoughts. I know we've talked about it a little bit, but why out of all diseases and conditions that are out there, these are the specific ones that USCIS is mostly concerned about? Are they just that much more transmutable than others, you think?
So why those in specific and not other ones? I'm guessing you would have to ask the actual lobbyists that created that, because at the end of the day, a lot of these policies are made by politicians and not public health professionals. But if we were going to think about actual reasons, syphilis is one of the biggest plagues that humanity has ever faced, killing over 100 million individuals through our history. Tuberculosis is still one of the diseases that kills the most people, and is very easily transmittable. Syphilis in its secondary stage, it doesn't have to be through sexual encounters. You can actually transmit it via touch. Wherever the actual rash is, which is characteristic to have it in the hands, you touch someone for long enough, you can actually give it to them. Wow. Tuberculosis, you cough, everyone next to you has been exposed. Gonorrhea, same thing. It's very easy. It's also a very common STI. The question is, why gonorrhea and not chlamydia, which is the most common one?
Right.
I guess that is a great question for whoever was the politician that made that policy.
Yeah. So if they were to actually ask, some of the doctors and medical professionals, you guys might suggest adding some, maybe removing some, and just kind of switching up a bit.
Yeah. That whole thing about looking for leprosy. I don't know any doctor other than an infectious disease doctor that works in a county hospital that has seen that more than a handful of times in all of their lives. And we can add doctors that are close to 80 years old. Still is something that you rarely see.
Yeah, definitely. So there's definitely some probably more rampant things that could potentially be added.
Oh, yeah.
All right. So then there's also a section on the physical or mental disorders that are associated with harmful behavior. So kind of talking about that, what are you looking for in regards to physical and mental disorders?
So that would, regretfully, it's something that there's no way that I can actually screen it in just sitting down with you. I have to rely on your medical history. If by any chance you say it or you bring the paperwork with it, some people, it's pretty obvious that they're not, all that. But most individuals, they could walk in, walk out, flying colors. We wouldn't know. It's something that either they tell us or they don't. So if they don't tell us, then it's a little bit difficult to just assess for it.
Yeah. So it would have to be something that you see. Is it recommended that people bring in kind of like their medical history, or is it something that's not really needed?
Well, my recommendation is be as honest as you can with anything. You don't want to be caught lying to the government. That famous saying, you don't lie either to God or the IRS. I think you can add immigration to that one.
Yes, definitely.
If you get blacklisted, well, you know how it is. 10 years before you can reapply.
Yeah,
that is not bueno.
It's definitely rough. So then you don't run there's no way to kind of test for substance or alcohol abuse or any kind of those disorders, anything like that you're going to do in your exam.
We could definitely test for it, but since it's not a requirement, we don't. But there's a lot of things that could be blood tested, and a lot of medications for mental health actually have titers. but that would make it into an extremely expensive test. And commercial insurance doesn't cover it. So you might have the best commercial insurance, but since it is considered an administrative exam, not a health exam, it's not covered.
So then, if a person mentions certain kind of prescription drugs or over-the-counter drugs that they use, is that something that you take into consideration at all?
We just write them down. I've had patients that have been approved that have active cancer. You would think about, expensive things. They got their green cards approved. I've had patients, normal stuff, like people would be scared. If diabetic was a reason to not get your paperwork, then half of the people that come to the United States wouldn't be able to obtain a visa because diabetes is extremely common. And those chronic conditions, we just document that you have them, that's it. I think that the government is more worried about transmittable diseases than anything else.
Yeah. So then if someone has had an addiction in the past, has since recovered, you don't really have a way of knowing this unless they share this information with you, correct?
Unless they tell us, there's no way we can know. It will be just how honest the person is. Of course, if the person has a DUI, the government knows.
Of course, yes. There's always ways to find things out, of course. So you mentioned, definitely better to be honest and upfront always. And so, in this day and age, a lot of people find themselves very anxious and, suffers of anxiety, depression, things like that. Those aren't things that you're looking for either, right? I mean, I know a lot of people are worried going in, like, well, I suffer from anxiety, I suffer from depression, things like that. Are they gonna mention something in the examination?
If they happen to mention it, my usual phrase is, don't worry. You and half of the people around you suffer from anxiety. So just learn how to manage it and just continue with your daily routine. At least for this, we don't worry about it, or at least myself. In the instructions that we get, it's about 20-page instructions. Doesn't tell us much about mental health.
Okay. Yeah. So then kind of talking about that, what level would they need to rise to so that you can document things like that in the medical exam? I mean, does it have to be like really erratic behavior, something very obvious?
If it's something very obvious, then I would require the actual medical record. So it'd be like, when I'm feeling it's like, something here doesn't add up. There's things that we have access to via the computers, but it's not that much. Down the road, the way the government is working is that they want that all the medical records actually be linked. When that's the case, you will not be able to hide any information. But as of right now, unless it's super obvious, and almost everyone can try to fake it at least for 10 minutes.
Yeah. So then what other kinds of conditions other than what we've kind of talked about already? Is there anything else that you're specifically looking for?
Not really. I've had patients that are paralyzed that get approved. I have patients that have mental issues, or I've had autistic, I've had trisomy 21s, Down syndromes. They've been approved. So it's more of just, at least to my knowledge, it's more about communicable diseases than anything else.
So then, like you already kind of mentioned, this is one that we get really often. People are definitely worried when they have high blood pressure, diabetes, high cholesterol, arthritis. I mean, these are so common among the population. And I know that they worry about it.
They shouldn't. They really shouldn't. The day they start requiring to be controlled, yes. But this is not a DOT exam. This is immigration exam.
Yeah, well, good. And also, you kind of mentioned some of the more, serious, maybe a little bit less common, but, cancer, Alzheimer's, lupus, heart disease, liver disease. These aren't things that people need to be worried about if they have when they're
Alzheimer's can complicate it because now we're talking about dementia. So how reliable are you? In that case, normally what ends up happening is that your paperwork is attached to someone else that is actually going to be your guardian and there has to be documentation that no one else can take care of that person. But that's a whole different process.
Yeah. So then if anybody has any kinds of these chronic conditions, is it wisest just to kind of take their history with them, have their prescriptions, their, any treatments, any surgeries, anything like that they've had in the past to go ahead and let you know?
At least the medicines that they take. Some of the times, like, they actually don't know the conditions. They know that they have to take 2 pills of the round white one in the morning, they have to take the yellow one in the afternoon, and they have to take the pink one and the square one in the evening. Like, what are the medicines? I don't know. They're round white. Well, there's only one blue one, but everything else.
Yeah. Okay. So then it's wisest for them to at least take the pictures of the bottles, if nothing else, so that you can kind of have an idea of what it's for.
Yeah. Oh, yeah. Smartphones really help.
Yeah, there's no reason why I guess we shouldn't have a lot of that information.
That's a good point that you actually brought up. So at least myself, for the vaccinations and all those documents, oh, my mom has them back in my country. It's like, perfect. Someone in the neighborhood probably has a smartphone. They can email you the picture of those documents. I accept that perfectly well because the only thing I need is to have a copy of that in my files. So the copy is right there, perfect. But yeah, smartphones for at least this process are very good for everyone.
That's really good. Yeah, no, that's good to know. And I'm sure some people have wondered that as well. Do I need my original card? Honestly, I don't know if I'd be able to find my card. I'm sure my mom probably has it somewhere in a closet. I know a lot of parents like to hold on to those records even when their children are adults. So
my mom has mine.
So there's no shame if anybody's parents have theirs.
I have a copy. She has the original.
Good. Yeah. As long as you have a photo then. All right. One of the questions, and this might be maybe more relevant to the medical examinations that are done outside of the U.S., but do you look at a patient's tattoos?
I think that would be called discrimination in our country. Definitely, we don't look at that.
Okay. Yeah.
Even if you have one that, even if it's a gang-related tattoo, from my end, I really cannot say anything because for all I know, you're actually seeking asylum because they're trying to kill you because you left the gang.
Yeah, so you don't know a person's immigration history. You don't know what kind of benefit that they're applying for. And in your case, it's not relevant to you.
That is between their lawyer and them. From the medical point, no, if they want to share that with me, that's excellent. But last time I checked, right now, tattoos is just body art, nothing else.
Okay, good. Yeah. So I know it might be a little bit different for those who are applying from outside, trying to come in. But at least for those adjustments of status and everything inside the U.S., they don't need to worry about their tattoos for the most part.
No, not at all.
Okay. Well, great. Just kind of anything other than what we've already talked about, is there anything that could happen where you just don't sign off on the medical exam or you can't complete your examination, anything like that?
Let's see. Honestly, I haven't seen anyone that once I start, I can't finish. Because what I always do is, okay, so you're missing this paper, and this paper, or you're missing this other thing, like a valid ID. Like once you can get that through your local, whether it is the embassy or it is the, I forgot the name of the other one, the consul, something like that. Consul, that thing. Okay, so you go, get that ID, and we're good. From my end, that's pretty much it. Or if for some reason they decided, I've had a few that after they come in, they're like, oh, I'm not gonna take the vaccines. I'm like, okay, I'm really sorry. I can't sign this without that. It's a very clear requirement and it needs to be a valid excuse not to do it. And just because I don't want to, it's not valid.
Yeah.
But
And then,
it's a very straightforward process, at least the physical point.
yeah.
Something might change in the next month, like a new vaccine or a new test, but it is almost like math, 2 plus 2. Just do, if we find this, we fix it, we sign it, you're good. I give you, you come in, you sign, you verify everything in the document, make sure that everything is fine. You sign it, and we give you the sealed envelope with the signature over it and a stamp. That way they know that it's not open. We keep a digital copy, we give you a physical copy, and that's it. It's intimidating, but it's a very straightforward process.
Yeah. And then one of the ones that we actually have way too often is that some people end up either losing their envelope, or for some reason they let it sit for too long and now, the signature has expired. One of the things they always ask is, can I just go get a copy from the doctor? Do they have to do a whole new exam?
So that one, it's supposed to be valid for 2 years, the exam. That's, at least from my end, that's what it's supposed to. But let's say that they introduced a new requirement, then I'm signing with today's date, not that date. So you would need to get it at least tested for that. And if you lose it and you need a new copy, if it's just a copy, I'll print one out for you. You should have it in your email because we already sent you a digital copy. But if you lost the official one and you need that one, then we would charge to make you a new one. You don't have to pay the whole thing, but we do charge for making a new document.
So, moral of the story, take care of it.
Oh, yes.
And turn it in as soon as possible.
If you lose it, you have to pay regretfully. Right. But something that we've encountered very recently, it's a lot of lawyers are saying that for X or Y reason, they need to get it again because it's been too long. And it's not been a full year since the test. So that I wouldn't know what's the legal reason, but I know that I've had more than a few that have had to have it done again.
Yeah, and it actually happens pretty often. So they're right now with COVID, actually, they've been actually very good about extending some deadlines. And so the way it was before is that your signature had to be within 60 days of them filing for their benefit. And so, 2 months doesn't give a lot of leeway. And so that's why a lot of people have had to redo them in the past. Now, right now, they're saying that they're willing to consider it no matter when the signature was. So definitely people should take advantage of that. But we don't know how long that's going to last. And so the day could come again when, they're saying it has to be within 60 days and it has to be everything filed, and with immigration and USPS and everything, there's always delays. So by the time they register it, those 60 days could be long gone.
I say that this current policy probably is good for the next 2 years. What happens? Well, we'll have to see when we cross over to that one.
Yeah, but, so we're hopeful that a lot of people who forget or lose things.
Yes. And oh my God, do they lose a lot of papers?
Yes, it is. It's hard. It's hard keeping track of things. I think it's a little bit easier in the digital age, but still, you have to sit down and take pictures or scan those documents and make them digital. So that's half the battle too.
I love when someone comes in and they have the classic accordion files and they have everything there perfect and they make sure that they seal it and then they put it on a bag so if it rains, it doesn't get wet. When I see one of those, I'm like, okay, we're good.
We'll be in and out in 20 minutes.
Oh, yeah.
Good. Well, good. Do you have any other advice for any patients who are getting ready to get their first medical exam?
Be honest and don't be scared. It's straightforward, it is easy, and really, there's nothing to be afraid of.
Good. Yeah. Look, you will see your smiling face in the exam room, and you seem like you'd make them very comfortable. So
if they're lucky enough, look for you. If they're lucky enough that they might also be greeted by one of my dogs.
Oh, that's great. That would make me feel a lot more comfortable too. So
you get to choose Frenchie or Bull Terrier. Which one?
Oh man, both isn't an option.
That's an option. It can be overwhelming because they demand love.
As they should. They deserve it. Well, good. Thank you so much. And kind of just to end on a different kind of note, what's your favorite thing about being a doctor? I know you said you may have pushed against it at first, but what gets you up in the morning? What's your favorite thing about it?
It's the same thing that I hate the most, the patients. The patient can make you love your profession one day, or it can make you question yourself if you should do it. The same thing as in the legal profession. What's the motivator? Helping people. What's the thing that makes you sometimes don't want to do it again? Some of the people that I try to help. So the answer is that definitely the patients is what I love the most and sometimes what I like the least.
That makes sense. And as always, we appreciate your honesty. So thank you so much for being here talking with us. I think this is going to help a lot of people kind of understand the process a little better and not be intimidated by it. And for anyone who is watching, who is lucky enough to be in the Dallas-Fort Worth area, they can look for Dr. Lopez in Irving in his clinic. And so, I know that you said you're in Irving. What was your clinic's name again?
Clínica Tu Salud, but if you forget Clínica Tu Salud, I'm the only Jaxel in the United States. So you put Jaxel in Google and it pops up like the lights in a Christmas tree.
So it's easy to find you then.
Yeah, I'm the only Jaxel that pops up in Google, doesn't matter where you type it in.
Well, good. Good to know. So anyone in the DFW area, you know how to find him.
Yes.
Okay, thank you so
before
much.
I forget, there's something that we didn't say.
Yeah.
How long is the process? Beginning to end. Normally, it takes anywhere between 4 to 5 business days. I know that some places they do it in 2 weeks, and at least in my clinic, usually within 1 week, everything is filed and signed. So
perfect. Good to know. So then, just kind of on that note, next day, not really feasible.
That would be impossible even if you have all the resources. Why? Because what actually determines the length is the reference laboratories. So how long do they take? And the one that takes the longest is quantiferin. We can order it stat, but even if we order it stat, it doesn't mean that they're going to do it immediately.
So getting it done with time, making sure that it's planned out with plenty of time, that's kind of the moral of the story for everything, really.
Don't leave this for last minute, please. Don't go saying I have the appointment in Friday and it's Monday. Like, it might happen, but more likely than not, it won't. So at the very, very, very least, 2 weeks, ideally 4 to 8.
Okay, good
that
to
way
know. Yeah.
We have plenty of time and we don't have to stress about anything.
Yeah, and then that way people have wiggle room and can definitely, in case anybody needs any additional treatment or anything like that, I'm sure.
Exactly.
Perfect. Well, thank you for remembering that. That's a good point. Well, thank you again so much, and we really appreciate it. And like you said, at the end of the day, it's nothing to be afraid of. It's nothing to be intimidated by. It's just kind of one of those things that has to be done.
Yes, it does.
All right. Well, thank you so much, Dr. Lopez, and we look forward to maybe having you on again. And I'm sure people are going to have different kinds of questions.
I'll be more than glad to answer them if I actually know the answer.
Great. Thank you so much.
Thank you for having me.